Gabrielle and Eve. I'm doing my IV video. The 7 rights are right drug, right dose, right time, right indication, right patient, right documentation, and then right route. Alright, and then you have to do your 12 safety practices. First, you verify your order from your doctor. 2, you wash your hands, do hand hygiene. 3, you verify your facility's policies and procedures. 4, you contact the manufacturer if you're using any equipment. 5, you knock on your client's door. 6, you use 2 identifiers. 7, you note the overall condition of your client. 8, you don PPE if needed. 9, you explain your procedure. 10, you will raise the bed for good body mechanics and lower the side rails. 11, I explain the procedure. And 11, you lower the bed, lower the side rails, but would raise them if it is indicated in the care plan. And then 12 is report any unusual findings to the charge nurse. So those are my 7 rights and my 12 safety practices. So now I am going to do my IV. And to do that, I'm going to raise the client to appropriate height. Push down my bed rail. And then I need to verify my order, not leaving. And at 8:30, I need to draw a CVC and Chem 7 and insert a saline lock. And for that, I'm just looking at him, seeing what vein I might do, and I'm probably gonna pick the hand. So I do my hand hygiene. I'm putting on gloves. And opening my kit. Okay, normally I would have had a needle before I did this, but I didn't have one. So we're gonna pretend that I had one, and we have one. I'm not leaving, he's okay. It's right over.
It's right there, the pink one. No. It's got a pink label. Do you see it? Oh, okay. Sorry, I didn't see that. Your hand was covered. I'm sorry.
Okay, I never left. I had the needle all with me, all along. Didn't even happen. Okay, so I have my kit all open, and it's all ready. I have my gloves on. I never left the room. The patient was here with me this whole time. I always had this needle with me. And we're going to apply our tourniquet to find an appropriate vein. And then you, sir, if you would not make a fist for me, I'm going to apply my tourniquet so I can find a good vein for you. Alright, I'm finding my vein. Looks like a good one right here. And I'm going to go ahead and pop my tourniquet real quick so that way I can assemble all my supplies. opening my needle. And normally if you were going to set the infusion up, that's when you would attach the lock. But since we are drawing a CBC and Chem 7 and just doing the saline lock, we're not going to do that yet. So I'm going to apply the tourniquet again. All right, sir, and just remember, don't make a fist, because that could mess up the results. All right, so see my vein again. We're gonna take our alcohol, rub vigorously in a circle, and then let it draw on its own. Do not fan, do not blow, anything. All right, now I'm going to take my needle, go, and then I move the catheter to make sure that there is no shearing or anything. The catheter is fine, and you will insert bevel up. All right, sir, it's going to be a little pinch, okay? You insert until you see blood return, and then since there is blood return, I'm going to pop the tourniquet, and then you advance the catheter, not the needle. Alright, and then you do your safety lock. Alright, dispose of this in the sharps container, imaginary sharps container. And we are occluding the vein. Then my imaginary CBC and Chem 7 tubes, you pop, they're filled up, invert, invert, pop, they're in. I have my tubes, they're over here, I will label them. And now I will insert the saline lock. While still occluding the vein, so there is no blood spilling over on the sheets. And then we are doing the saline lock. And remember, the tourniquet is clipped off. Jesus. Okay, we are flushing with the saline, and then we attach our Tegaderm, making sure this is locked right there, but we attach our Tegaderm so that way it will not move. And then we date it, we put our initials on it, and put the time on it. And also, if you had any multiple attempts or anything, you would document that. And we will lower the bed, make sure he's comfortable before we leave. We would side rails, take off our gloves, hand hygiene, and then we'll come back at 10 o'clock and do our normal saline infusion. Knock, knock. Hi, it is 10 o'clock and I'm here to hook up your normal saline at 125 milliliters an hour from the doctor. So I am going to raise your bed for good biomechanics. Alright, I'm going to put your side rail down. These are new gloves, and this is applied. Alright, we have it on a pump to 125 milliliters an hour, so we don't have to worry about drip rates or anything. We are going to take our alcohol pad and scrub. Then we attach this to the saline lock and we instill the prescribed rate of normal saline. Are you comfortable? Are you okay? Everything is okay? There's no sign of phlebitis or anything, any swelling. So I'm going to bring back his side rail and make sure he is comfortable. I would put it down all the way and then leave, wash my hands, perform a hand hygiene, and document. So I come back at 11:30 to deliver morphine 2 milligrams IV stat. Knock, knock. It is 11:30 and the doctor has ordered 2 milligrams of morphine. Now I'm gonna go ahead and give that to you. So I raise my bed again. Again, hand hygiene was performed. These are clean gloves. And push the side rail down. So 2 milligrams IV stat, and this is my morphine. You will Alright, I take my alcohol pad. You need to kink your line, take it, scrub it so there is no infusion of any bacteria. Then you twist in, make sure you're kinking so it doesn't go back into the bag. It'll go straight into the patient. Push slowly. And then once the instilled amount is given, and it was 2 milligrams given. Line was kinked. The patient received all of it over the course of 2 minutes. Then, are you okay? Are you still in any pain? No, okay. So, lower the bed, do his side rails according to his care plan, if he has them or not. Then I remove my gloves, perform hand hygiene, and I document. And that is everything.